milestone, surpassing 200,000 coronavirus deaths. Joining me now to talk about that and the impact of the president's coronavirus response on healthcare, two workers, people who have been fighting the virus on the front lines. Dr. Jeremy Faust, emergency room physician at Brigham and Women's Hospital and an instructor at Harvard Medical School, and Aubrey Ness, intensive care nurse at the University of Chicago Medical Center. Welcome to you both. And by the way, I first want to start off by saying thank you for all the work that you have done throughout this entire pandemic, and honestly throughout your lives, because you help us every single day get better, putting it simply. Dr. Faust, I'm going to start with you on this one. We just surpassed this grim milestone, 200,000 deaths in this country. It is astounding to even think about if we go back to March, when we felt like life was normal. You feel as if it is more than 200,000. Why?
That's right. We saw this coming. We see that there's not enough testing, and therefore we're actually missing a lot of cases. People are dying, but we know it's from COVID. We know that because of a lot of different circumstances. So in fact, there have been closer to 250 extra deaths than there should have been by now. This year is going to go down as the first year in American history where more than 3 million Americans die in total. Every year, 270, 280, 2.8, 2.9 million people die in this country. And this year, we're going to go way over 3 million for the first time. And it's a real impact. You have to go back to the 1960s to get to the kinds of death rates just for the whole country that we are now seeing. So this is historic, and it's a sad day, except it's really extra sad because we've seen this coming for weeks and months now, and we just seem to not have the political will to make any real changes. Look what's happening. People are going about their lives, and then the deaths just keep adding up.
Aubrey, I want to talk about the reaction that you had to the Bob Woodward book and the tapes that we heard, the interactions that Bob Woodward had with the president, in which the president said that he downplayed the virus back in February, that he basically said it was like the flu. He likened the coronavirus to the flu. And he said it because he said he didn't want to cause panic throughout this country. You called that reckless endangerment. Explain your reasoning there.
Well, these people did not deserve to die. The American people deserve a better plan, a more concise message on the virus, and for him to lie is completely irresponsible. And it's one thing to lie, and it's another thing to possibly withhold the truth. And he decided to lie, and that causes so much misinformation, and people have the wrong message, and people don't take it seriously because they feel like they can't trust the information that's coming out, and I think it's unacceptable.
So you, Dr. Faust, actually said about this moment in which the president misled the public, told falsehoods, lied to the public about the severity of this virus, that it just doesn't ring true to have that moment even occur. You actually said that at Market Watch earlier on in the week when you appeared there. Elaborate on that for me.
What I meant by that is, as a physician or a healthcare provider, we frequently tell our patients the truth, no matter how dire it may be. We say, look, here is the situation we have, and let's lay out the options. And I have found in my career that patients, Americans, but everybody, can really handle the truth. And what they can't handle, though, is being misled. If you tell someone, here's what's going on, and it's not great news, a lot of the times you'd be surprised. Patients say, okay, you know what, I knew something was up, something was wrong. Now let's make an action plan that can really maximize my chance for a good outcome. And that's what we didn't have here. We didn't have a chance to have the full reckoning, the public should really have known what we were concerned about. And if we had done that, we wouldn't have PPE supply line chains because people would have demanded for that change to have occurred earlier. We're starting to see that crop up again.
So Aubrey, as I mentioned, you've been on the front lines throughout this whole entire thing. You know what flu season normally looks like. You know what the coronavirus has looked like for the last 6.5 months. There is this overwhelming fear in this country that flu season is going to coincide with the coronavirus. It will. But that more people will die because of it. Do you feel like amidst all of this, that we can get this thing under control from what you've seen?
I think it's going to be very challenging. Obviously, we're going to do the best that we can. That's all we can do. But I really wish that we had a more concise level of leadership for the country, so we can get on the same page. Everybody can get on the same page. so that everybody knows what they're supposed to be doing. And I would like to take the politics out of this also. Politics has no business in this pandemic.
Dr. Faust, I just quickly want to ask you, because I've actually always wanted to ask a healthcare worker this in one of these interviews, and I haven't had the opportunity, and that is, are you guys getting enough emotional support throughout this whole entire thing? Because we consider you heroes through all of this. But it's not easy to see all these people dying in your hospitals, in your offices.
Well, thank you for asking that question. And the answer is, it depends on the situation. Some people really have suffered. People have had to see things that were worse than war zones. My friend Sion Firu worked in Iraq and then also worked in New York during COVID. And she said COVID was worse. And we had more physician suicides. It was National Physician Suicide Awareness Day a few days ago. And it really was a meaningful thing to think about, because in many places where we don't feel the support, it's really a problem. Now, when we have the support, when we have the PPE, when we have people saying, hey, we're on your side and we're going to support policies that will give you the things you need to make the most number of saves possible, then we love going to work. We love going to work and doing our jobs, and that's what we want to continue to do.
Dr. Jeremy Faust and Aubrey Ness, thank you to you both for every single thing that you do every day. Still ahead.
Thank you so much.
The president hits the campaign trail.